Artificial Intelligence Doctor. User question. How to treat high troponin T high sensitivity? AI answer. Of course. This is a very important question. It's crucial to understand that a high troponin T high sensitivity, HSTNT, level is not a diagnosis in itself, but a critical sign of potential heart muscle damage. The most important first step is to immediately consult a healthcare professional, e.g., in an emergency room or with a cardiologist. Do not attempt to self-treat based on this information. Here is a comprehensive breakdown of what a high HSTNT level means, how it's treated, and what you need to know. First, what does a high level mean? Troponin is a protein found almost exclusively in heart muscle. When heart cells are injured or die, like during a heart attack, they release troponin into the bloodstream. The high sensitivity test can detect very tiny amounts, making it an extremely sensitive marker for heart injury. A high level indicates myocardial injury, heart muscle damage. The higher the level, the more extensive the injury is likely to be. However, the cause of that injury must be determined. Step 1. Diagnosis. Finding the underlying cause. Treatment is entirely directed at the cause of the elevated troponin. Doctors will run tests to determine why it's high. The causes are broadly categorized into two groups. 1. Acute coronary syndromes, ACS, heart attack, and related issues. This is the most critical and time-sensitive cause. It occurs when blood flow to the heart is blocked, usually by a blood clot in a coronary artery. Symptoms: chest pain, pressure, tightness, or discomfort. Pain radiating to the jaw, neck, back, or arm. Shortness of breath, nausea, cold sweat, lightheadedness. Diagnostic tests: ECG, EKG, clinical history, and often a rising and/or falling pattern of troponin levels over hours. 2. Non-ACS causes, other reasons for heart strain or injury. Many other conditions can strain or damage the heart enough to release troponin. The pattern is often a stable elevation without the typical rise/fall of a heart attack. Cardiac causes: heart failure, myocarditis, heart inflammation, pericarditis, inflammation of the heart's lining, cardiomyopathy, severe arrhythmias like very fast AFib, cardiac contusion, injury from trauma. Non-cardiac causes: pulmonary embolism, blood clot in the lung, severe COPD. Renal, chronic kidney disease, the kidneys don't clear troponin well. Other, severe infection/sepsis, strenuous exercise, e.g., marathon running, stroke, critical illness, chemotherapy toxicity. Step 2. Treatment based on the cause. The treatment is 100% dependent on the diagnosis. If the cause is an acute coronary syndrome, heart attack, this is a medical emergency. The goal is to restore blood flow to the heart as quickly as possible. Emergency procedures. PCI, percutaneous coronary intervention, also known as angioplasty and stenting. A catheter is threaded to the blocked artery to open it up. Thrombolytics, clot-busting drugs if PCI is not immediately available. Medications, antiplatelets, aspirin, clopidogrel, Plavix, ticagrelor, Brilinta to prevent new clots. Anticoagulants, heparin to prevent clot extension. Statins, high-intensity statins, e.g., atorvastatin, rosuvastatin, to lower cholesterol and stabilize plaque. Beta blockers, to reduce heart rate and blood pressure, lowering the heart's oxygen demand. ACE inhibitors/ARBs, to reduce strain on the heart and prevent remodeling. Lifestyle changes, cardiac rehabilitation, diet, Mediterranean, exercise, smoking cessation. If the cause is non-ACS, e.g., heart failure, myocarditis, etc., treatment focuses on managing the underlying condition. Heart failure, diuretics, water pills, ACE inhibitors/ARBs, beta blockers, SGLT2 inhibitors. Myocarditis/pericarditis, anti-inflammatory medications, NSAIDs like ibuprofen, colchicine, sometimes steroids. Rest is critical. Pulmonary embolism, anticoagulants, blood thinners. Atrial fibrillation, rate control medications, beta blockers, calcium channel blockers, anticoagulants, and/or cardioversion. Sepsis/infection, antibiotics for fluids and supporting organ function, chronic kidney disease, managing fluids, electrolytes, and blood pressure,